So thank you to everyone for joining us. I'm really happy to be moderating this session. I am Dr. Richard Cohen. I am a professor at Nassau Community College on Long Island, New York, and I would be remiss if I did not welcome our immediate past president, Miss Catherine McDonald, who is, the backbone of the entire NRHC, and nothing would have been accomplished over the last couple of years without her contributions. So thank you for joining us this morning.
No problem. I'm going to be zooming all around because I have 4 students presenting, one of which is here right now. So good morning, everybody. I'm glad to have you all here on a Sunday morning, bright and early.
Nothing like a 9 o'clock presentation on a Sunday morning. So I am a scientist by training, and most of the sessions I've moderated previously were all science related. So this session could not be further from my wheelhouse than possible. So I'm really looking forward to hearing all the presenters speak about their topics, because I know almost nothing about this, and I'm really looking forward to learning a tremendous amount this morning. So this session is Issues Facing Immigrants and Subsequent Generations. We're going to first hear from Magali Zuniga from Monroe College, COVID-19's toll on immigrants, bringing awareness to their struggles. Then we'll hear from Amani. I apologize that I'm not going to be able to pronounce your last name. Can you pronounce it for us, please?
Yes, sure. Obeidallah.
Thank you very much. From Fairleigh Dickinson University, the effects of acculturation, inculturation, and ethnic identity on attitudes towards seeking mental health services among Arab Americans. And then we'll be wrapping up with Matthew Zember from Shippensburg University, The Zember Family Story, a documentary on the impact of Slovak immigration in Pennsylvania. So Magali, please lead us off.
All right, thank you so much. Good morning, everyone. I hope all is well. Let me just start sharing my screen real quick. I think that this is it. Okay, can you all see? Okay, great. So my presentation focuses on COVID-19's toll on immigrants and bringing awareness to their struggles. And for today's agenda, hold on, is it working? Okay, so today's agenda will be going through an introduction, some key terms that will be mentioned throughout the presentation, the representation of immigrants in the workforce and their contributions to the economy, obstacles that they faced before the pandemic and issues that they're facing during the pandemic, and finally, in conclusion, asking what can we do? So what's been going on? There is no doubt that everyone in this world goes through some kind of struggle, whether it be financial or personal instability. There's always something in life that makes it much more difficult than it should be. Yet, as people, we prevail and still manage to get through them. But for some people, it's much more difficult to do this. And for the group of people that I'm focusing on, which are immigrants, it's much more difficult for them to do so since they reside in a country that doesn't welcome them with open arms, despite the many contributions that they make, especially now during these uncertain times. So some key terms include the public charge rule, which considers an alien to be a public charge if they use any of the following public benefits for a span of 12 years over the course of 3 years, which include SNAP, also known as the Supplemental Nutrition Assistance Program, which provides food benefits to low-income working people, the elderly, and the disabled. Section 8 housing, which allows landlords to rent out apartments or housing at low affordable costs for those that are eligible. Medicare Part D low-income subsidy, which helps people with Medicare pay lower prices for their prescription drugs. The CARES Act, which has benefited the majority of us in this room maybe with quick relief funds. Cultural assimilation, which is the need to abandon their culture in order to fit into our society. Multiculturalism, which is the coexistence of many cultures and races. And culture is one's own beliefs, their customs, while race is a biological factor. And undocumented immigrant and worker, which is someone who doesn't have permanent residency in this country or their legal status is unsure. So, many US-born citizen workers believe in the myth that claims that immigrants are stealing their jobs. And even though that there are immigrants that work in the same occupations as their citizen counterparts, they aren't stealing them. Rather, they're working with them or in other occupations that complement them in order to stimulate much more greater economic activity. The Center for American Progress found that immigrants make up a significant number of these occupations, and the numbers here are focusing on undocumented immigrants. And I just want you all to take a moment to read these numbers and tell me in the chat or through mic, which one's the one that you found much more surprising. And a quick disclaimer, this isn't everything, for not all of them are accounted for. I can't see the chat, so if you're using it with someone, please read it to me. Let's see if I can open it. Okay, 25%. Also, yeah, I found that one surprising. Also the 30%, which I expected to be much more greater, but again, not everyone is accounted for. Construction, okay. Let's see. All right, so moving on. A quick quiz. How many immigrants do you believe are in the medical field right now? A, 500,000, B, 1.7 million, C, 2.4 million, or D, 3.5 million? B. Okay, someone said 2.4, C. Okay. The correct answer is B. There is an estimated 2.4 million immigrant workers in the field right now. And again, these numbers are representing the undocumented immigrants, which include 242,000 registered nurses and licensed practical nurses, 168,000 lab diagnostic technicians, and 164,000 home health aides, nursing assistants, and personal care aides. And although these occupations tend to earn a higher income, there are immigrants that are in lower income occupations that complement them, such as the 188,000 custodians, food servers, and administrative workers that help keep these facilities running. Is it working? Okay. So the future projection of needed undocumented workers is roughly 1.2 million home health aid and personal care aides, along with nearly 1 million additional workers in fast food services, restaurants, and other occupations that already have a high number of immigrant workers in them. And this is according to the US Bureau of Labor Statistics, that as baby boomers continue to age, they will need other workers in these occupations to support them. And by 2040, give or take, the minorities, which are people of color and Black individuals, will make up the majority population, which is why there will be an increase in immigration workers in these kind of fields. All right, so their economic contributions. Now, I want you also to take a moment to look at these numbers and tell me which one's the one that you found most surprising. Again, these aren't all that's taken into account for, this is all that we know. And all of these taxes make contributions to infrastructure projects such as road repairs, bridge repairs. They also fund schools. They make big contributions to Social Security and Medicare, which is something that they don't reap the benefits from. And they also come into funding for the military as well. I can't see the chat, so if someone could just read it, please, if there's anything. Okay. Yeah, the Social Security is really high as well. Okay. So some obstacles that they faced before the pandemic. Multiculturalism is something that is evident here in the United States since we are known as a melting pot. However, that doesn't mean that it is the most friendly towards immigrants. There's obviously the language barrier, which makes it difficult for them to make simple gestures or to complete simple tasks, such as asking for directions, making appointments, or even go food shopping by themselves. In order to feel accepted by our American society, they feel the need to abandon their culture and become culturally assimilated in order to diminish their experience with discrimination. And also, this comes into account with children. For immigrant parents have to teach their children to abandon their cultures as well. And those who do practice their cultural beliefs are typically discriminated against and bullied in schools. And because of the language barrier, parents can't easily communicate with faculty and staff members in order to resolve these issues. Before I move on to the next session, I would love to know what are some of your standard living conditions. You can either write it in the chat or you can unmute your mic. And these include housing, transportation, anything with food related issues, money, all of that.
Yeah, I know right now I'm living off campus here at Shippensburg, and so I have my own place to live. I do have a car that I can drive to and from school with. We have electricity here, and we have our fridge, washer, dryer. So I'm very grateful to have a lot of these conditions that we probably take for granted.
Yeah, that's great. That's great. I'm not sure if anyone else would like to, let me see the chat before. My family house, my own car, multiple appliances, heating and AC, yes. And these are all simple things that we all take for granted, in my opinion. Okay, so there's no questioning that safe and affordable housing don't go hand in hand. Typically, safe housing is in well and safe neighborhoods, and they can be really expensive. So these immigrants are forced to look into lower paying housing, such as apartments in rather unsafe environments. And they're typically far away from public transportation or any vital necessities such as foods, grocery stores, healthcare facilities, and again, public transportation. But there is such a thing called public housing. And if there is at least one documented immigrant in the household, these people can apply for them, but they don't have the best sanitary conditions. Not to mention, if you live in New York City and have ever taken the public subways, you can tell that they don't have the best sanitary conditions as well, and they get rather crowded very fast. And both of these images depict some of the living conditions of New York City Housing Authority residents, also known as NYCHA residents, which is a public housing complex down in the lower income communities and poorer communities in New York City. And as you can see, there's mold everywhere. A child doesn't deserve to be in these conditions because they are rather unsafe. There are also rodents that carry a lot of diseases that come into their houses, which is, in my opinion, very, very disgusting, but it's something that these people go through on a daily basis. There's also a factor of jobs, and if you ever have the time to make a conversation with a taxi driver, they may go into their story of how they used to be an engineer or a teacher or a doctor back in their home country. However, their certifications don't successfully transfer when they come to the United States, so they can't apply for the same jobs that they had back in their home, which leads them to taking rather unstable occupations that have unstable wages, and they don't have the opportunity to take any days off if they get sick. And it leaves them struggling to support their families as well. There's also healthcare. And when the Department of Homeland Security implemented the public charge rule, there was a great misunderstanding with it. It states that pregnant women, and there are some other individuals who can apply for the public health benefits, but such as Medicare, but as a result of fear from the public charge rule, a great number of them have unenrolled themselves and their children, which includes 676,284 influenza patients, 615,842 asthmatic patients, 53,728 epileptic patients, 618,302 newborns who are in need of immunizations and general checkups, 1.1 million that are in need of specialists, and 946,272 that are in need of prescription drugs. And now, these issues before the pandemic have amplified their current situation now. As previously mentioned, as you could see in the previous picture, they live in rather unsanitary conditions, and they're also forced to live in larger households in order to save on the rent and their utility bills, which makes it harder for them to practice social distancing. So if one person falls ill with the coronavirus, it's no surprise that all of them in the household fall ill to this, since the majority of them live in a 1-bedroom apartment and there's 8 people sharing this apartment. Also, they're dependent of public transportation, which also has unsanitary risks, or they're exposed to sanitary risks. And since it becomes overcrowded very easily, again, they have no space to practice social distancing. So if there is one individual that is ill and is asymptomatic with the coronavirus, then they put other people at risk as well. And before I move on, how has your work been affected by the pandemic?
So I'm a professor,
Mhm.
and I've been teaching remotely since last March. So I taught half of spring 20, and then all of summer, then all of fall, then all of this semester remotely. So obviously it's been a complete change from what I'm used to. It's
Mhm.
been an interesting experience, but I'm very much looking forward to going back to teaching in person.
Yeah, I agree with you. I agree. I miss the in-class environment as well. Does anyone else want to make a contribution?
I know right now my university is still doing mostly online classes, and it's been that way pretty much since March as well. I tried looking for a summer internship last summer, but the university regulated that any internship had to be fully online. So it was really tough to find an internship, and I wasn't able to find one. Even now, I'm still struggling to find an internship for this summer. So it's
Yeah.
definitely been hard for everyone.
Yeah, I agree. It's really been affecting everyone. Um, but although we have the opportunity to work from home or to stay home during these times, these individuals don't have the same privilege since they work in really unstable jobs, and the majority of their occupations can't be done from home. They work in grocery stores, they work in restaurants, they work in any occupation that they can find, and the majority of these don't offer um, at home work. They also experience major cutbacks in hours, and many of them that have been fired last year are still struggling to find jobs this year. And as you can see, they experience a much more higher unemployment rate, with 15% of foreign-born men losing their jobs in 2020 and 18% of foreign-born women as well, compared to only 13% of US-born men and 15% of US-born women losing their occupations. Not to mention, the same issue with certification comes into play. However, some very little, a very little amount of hospitals, I'm not exactly sure where, it never said, but they allow previously certified doctors or nurses that were in different countries to work in the United States during the pandemic, which is something good. Obviously, they have a chance to find a job, but this is for much more higher income jobs only.
Just as a time check, we have slightly less than 4 minutes remaining.
Oh, okay. All right. So I'm going to skip this. So essential workers, there are roughly 1.7 million workers in the nation's food supply chain, as well as 358,000 farm workers and food processors, and 154,000 immigrants in supermarkets and grocery stores and convenience stores. So it's more than likely that you're going to interact with an undocumented or illegal immigrant. And also the lack of health insurance has played a huge role in this. Since they don't have a primary care physician, they don't have the opportunity to call into the office if they're experiencing COVID-like symptoms. So they have to rely on emergency health care. And the thing is that the majority of immigrants tend to wait until their conditions are life-threatening to go because of the high amount of money, the high payments that they'll have to make. Also, ICE has instilled a deep fear in these individuals since many of them fear the public charge rule, and they fear that a worker in any of these facilities will expose them of their current status, which is why they tend to avoid them. And again, the public charge rule doesn't apply for every single one of these needs, as the Department of Homeland Services clearly stated that an immigrant is not forced, but they're recommended to receive testing as well as vaccination, and they will not be accounted for as a public charge. But there is a great misunderstanding in this community. And finally, I ask you, what can we do? We're not in a high position of power, but it is rather difficult for many people to really understand the fear that they have during these times. So I would just like to know, what do you think we can do at a much more personal level to kind of confront these fears and to comfort these individuals?
I definitely think something that everyone can do is really take part in the conversation and really raise awareness about the situation, because some people just may not know what these immigrants are really facing on a daily basis. So it's really important to really raise that awareness so that people can know that there is a problem to be addressed. And once that problem is brought to people's attention, more people will likely be willing to help, be willing to do things that can help these people have better living conditions, better employment circumstances, and etc.
I completely agree with you. This is a conversation that we have to have, even if it makes us uncomfortable. All right, so I guess that's it. These are my references, and thank you so much for listening.
Thank you, Magali. That was really fascinating. You did a really great job and brought up several very important points. And hopefully at the end, we'll get a chance to cycle back and have a larger discussion and how that relates to the next two presenters. The next of which is Amani Obeidallah. Hopefully I said that correctly, from Fairleigh Dickinson University, who will be discussing the effects of acculturation, inculturation, and ethnic identity on attitudes towards seeking mental health services among Arab Americans.
Thank you. I'm going to go ahead and share my screen. Please let me know if you can see my slides. Wonderful. Okay. Good morning. Thank you for attending my presentation. I'm Amani Obeidallah from Fairleigh Dickinson University, and I conducted my study to investigate the effects of acculturation, inculturation, and ethnic identity on attitudes towards seeking mental health services among Arab Americans. I'd like to start off first with an introductory exercise. Please raise your hand if you've been to the doctor's office within the past year. Wonderful. Now, if I were to ask you to raise your hand if you've been to a mental health professional's office in the past year, chances are you'll be a little bit more hesitant to put your hand up. And this probable hesitation is a result of the stigma surrounding seeking mental health services in the US and elsewhere. But by attending this presentation, you and I are really starting that long overdue conversation of mental health needs. Before delving into attitudes amongst Arab Americans, I'd like to discuss the mental health crisis in the US. 1 in every 5 American adults experience mental illness, and 1 in 20 adults experience serious mental illness, which is a mental illness that significantly impairs one's functioning. When we think of mental health, we often think of it as an individual interest, but the impacts of mental health go far beyond the scope of just the individual. Individuals with serious mental illnesses, like I said before, are mental illnesses that significantly impact one's functioning. Those people are at increased risk for chronic diseases such as heart disease. And then it also expands out to the family level, the community level, and the world level, which results in $1 trillion lost in the global economy every year due to lost productivity as a result of anxiety and depression. So evidently, the impacts of mental illness really have drastic effects on every level in an individual's life. In 2013, the World Health Organization, or the WHO, implemented a comprehensive mental health action plan with the statement, "No health without mental health" at its core, which really spoke to the importance of seeking mental health services when appropriate. And doing so can really enhance someone's life satisfaction, allow them to have a better understanding of their own emotions, make them better able to cope with day-to-day stresses, which we're all not strangers to due to the pandemic. It also encourages healthy relationships and evidently allows for more contributing, positively contributing people of society. So there seems to be a misconception that minorities experience less mental health disorders than non-minorities. However, they are just as likely as non-minorities to experience mental health disorders. But the disparity and the issue really arises when we look at treatment. So minorities are far less likely to receive treatment due to mental health stigma in their communities, language barriers between them and their providers, lack of cultural competency in these mental health providers, and lack of diversity in the providers. Investigating the stigma of mental health in minority communities, specifically Arab American communities, as I did in my study, is really essential to reduce the disparity in treatment for all populations and really ensure that everyone gets the services they need. So since our research used acculturation, enculturation, and ethnic identity as predictor variables, it's really important to have a good understanding of these concepts that ethnic minorities interact with on a day-to-day basis. Acculturation is the process of adapting to a new culture, whereas enculturation is preserving one's culture of origin. For example, as a Palestinian American, acculturation to me might look like eating American food or reading English magazines, whereas enculturation might look like singing Palestinian songs or wearing Palestinian dress. And ethnic identity is as it sounds, and it really speaks to the individual's sense of belonging to and the interpretation they have of their ethnic group. We hypothesize that higher acculturation levels to Anglo or American culture will be associated with more positive attitudes towards seeking mental health services. We also hypothesize that lower enculturation levels will be associated with more positive attitudes, and lower Arab ethnic identity would be associated with more positive attitudes. For our procedure, it was quite simple. After IRB approval, we recruited participants through 2 local community centers, the Palestinian American Community Center and the Islamic Center of Passaic County. And these 2 organizations distributed our survey via email, social media, and website to their community members. The study had a total of 48 participants in the sample, 40 of which were female and 8 were male. So this sample was predominantly composed of women. The average age of the participants was 37, with about 52% born in the US and about 48% born outside of the US in countries, just to name a few, Palestine, Jordan, Egypt, Syria, Brazil, and Puerto Rico. And as shown by the last 2 boxes on the lower right-hand corner, this sample was of relatively high socioeconomic status. Our survey consisted of 4 different measures. First, of a demographic questionnaire that we devised that collected data for sex, age, citizenship status, religion, etc. And we also used 3 validated scales. The first being the Stevenson multigroup acculturation scale, which measured enculturation or ethnic society immersion, and acculturation or dominant society immersion. The second validated scale we used was the multi-group ethnic identity measure, which measured ethnic identity or someone's sense of belonging to and the interpretation they have of their ethnic group. Our outcome variable and the last scale we used was the inventory of attitudes towards seeking mental health services, which measures the factors that influence the attitudes that contribute to your total attitudes. And those 3 factors are psychological openness, help-seeking propensity, and indifference to stigma. To kind of define these terms to give you a better understanding, psychological openness is defined as an individual's recognition of mental health issues and having the possibility of seeking help for these issues. Help-seeking propensity is the willingness and ability to use these services or mental health services, and indifference to stigma is regard to others' opinions regarding your desire to seek help or your interest to seek help. And of these subscales, indifference to stigma was of least interest to us due to previous findings. Thus, most of our discussion today will focus on psychological openness and help-seeking propensity. We looked at the correlations of the predictor variables to one another. Enculturation positively correlated to ethnic identity, whereas acculturation did not. Acculturation also did not correlate to enculturation. And we also looked at the correlations of predictor variables and the outcome variable, attitudes towards mental health services. We found that enculturation negatively correlated to psychological openness, whereas acculturation positively did. And acculturation also positively correlated to total attitudes. And these three hypotheses were consistent with our, these three correlations were consistent with our initial hypotheses that enculturation would be associated with negative attitudes, whereas acculturation would be associated with positive attitudes. Interestingly, we found that ethnic identity positively correlated to help-seeking propensity, which was opposite of what we hypothesized. And while these correlations are interesting and noteworthy, it's more interesting to us to look at the regression analysis because it gives us a better understanding of the variables and how they can significantly predict attitudes towards mental health services. So we conducted 4 regression analyses between acculturation, enculturation, ethnic identity, which were the predictor variables, to the outcome variables. We have 4, so the first being for total attitudes, and the other 3 being for each of the subscales of that total attitudes measure. We first looked at the total attitudes, and we found that this model was significant as indicated by the p-value of less than 0.05 in step 2. And we found that the significant predictor of this model was acculturation, and acculturation was positively associated with more positive total attitudes, which supported our initial hypothesis. And essentially what this means is that the more acculturated one is to American culture, the more likely they are to have positive attitudes towards mental health services. When we looked at psychological openness, we found that this model was also significant, and the predictors were, or the significant predictors were acculturation and enculturation. And as predicted, enculturation negatively correlated with psychological openness, such that those with lower enculturation had more positive psychological openness, and also consistent with our hypothesis, acculturation positively was associated with psychological openness. So those with higher acculturation had higher psychological openness. When we looked at help-seeking propensity, we also found that the model was significant as indicated by the p-value, and the significant predictor of this model was ethnic identity. And this regression really revealed that ethnic identity was positively related to help-seeking propensity, which was actually counter to our initial hypothesis. Interestingly, this indicated that those with higher ethnic identity have greater help-seeking propensity. And last, we looked at indifference to stigma, and our analyses showed us that the model was not significant, indicating that acculturation, enculturation, and ethnic identity were not significant predictors of indifference to stigma. Just to summarize our findings, higher enculturation led to more negative attitudes towards psych openness, whereas higher acculturation led to more positive attitudes towards psychological openness. And higher ethnic identity was related to greater help-seeking propensity, and higher acculturation had more positive attitudes towards just overall mental health services. So what do these findings really mean? we really saw that acculturation and enculturation had a significant relationship with psychological openness. And this is because acculturation and enculturation are really lifestyle-based processes, which the measure that we use, the Stevenson measure, it really looks at the language one uses, the clothing, the family relations they have, their food habits, their social life. And the lifestyle one chooses to really be a part of can largely impact their view on the world, and in this case, their view on mental health. So we also found that ethnic identity was significantly related to help-seeking propensity in the positive directions, surprisingly. So ethnic identity, just to reiterate, is one's perception of and their sense of belonging in their respective ethnic group. And the measure that we used really was asking questions about learning, being interested in the history of your group or the traditions of your group. Do you feel attached to your group? Those are the types of questions that were in the measure. And so it wasn't really lifestyle, it was more, what do you identify as and what are your interests in your group? And this increased sense of belonging and having a perceived sense of support was found in a previous study to encourage willingness towards seeking mental health services, which kind of explains our findings in a way that is supported by previous research as well. So how can we use our findings in a meaningful way? We suggest to hold community outreach and mental health literacy programs by holding workshops and seminars in Arabic, or the most common language of the community. And we can really focus on the most common issues faced by minorities and provide these members or attendees with a list of local mental health providers to really encourage them to go use these services. We also propose a collaboration between my university, Fairleigh Dickinson University, and PAC and ICPC, which were the organizations that we recruited our members from, or our participants from. And collaborations with these organizations will allow us to effectively address the findings of the study, because we're likely to reach the same population that we collected the data from. And I also propose that PhD students in Fairleigh Dickinson University, specifically PhD in psychology candidates, can visit these centers to really promote attitudes or positive attitudes towards seeking mental health services. And this is kind of a win-win situation where the students, the psychology PhD students, will be able to have greater access to more diverse participants in their research, and Arabs will have greater representation in psychological research, as they are a very underrepresented group in psychological research. Lastly, we propose that schools densely populated with Arab Americans, such as in cities like Paterson, New Jersey, or Clifton, New Jersey, should really ensure that students, faculty, staff, and administration have a good understanding of Arab cultural beliefs and practices. And this can be done by having mental health professionals come to the school, hold assemblies, and really raise that awareness and really tell them the importance of having cultural sensitivity and cultural competency in the school environment. And having informed school personnel, specifically guidance counselors and school psychologists, will be setting up the students who are Arab and suffer from mental illness, will be setting them up to be better served, to be more understood, to feel more welcomed and comfortable in their school environment. So for my future research, I'd like to explore the interactions between the predictor variables and their interactive effect on attitudes towards seeking mental health services. So for example, if someone has high enculturation and low acculturation, how do these two factors really work together to produce their attitudes or to influence their attitudes towards mental health services? I'd also like to reconduct the study to test the efficiency of the interventions that I just proposed. And doing so will allow us to have a better understanding of how to approach other minority communities that also deal with mental health disparities. And conducting this study really sets up a nice foundation for me to build upon to do future research in my academic and professional career. And there is a lot to be done, but as I said, the first step is always to start that conversation. So thank you for listening. I appreciate you being here. If you have any questions, please feel free to type them in the chat or unmute your mic. Thank you.
So we have about 3 minutes for questions. So does anyone have any questions for Amani?
I have one question.
Sure.
It was a great presentation, by the way.
Thank
I learned a lot. I was wondering that, like, when you if you were to reconduct this study, like this same study again, would you maybe like recruit like a wider population of Arab Americans? Just because, like, if I was just thinking that maybe the population, if they're like belonging to these groups that you recruited from, would they have a higher ethnic identity because they were part of these communities already? So like, would you recruit maybe from a wider population that maybe isn't as closely associated with these communities?
That's a great question. And I think that would be the goal, essentially, to really get like a national sample of Arab Americans from all different kinds of backgrounds. But then again, we also need to have some kind of control variable. So really recruiting these participants from these centers that I chose was just because I wanted to have a local impact and really be able to implement what I find to the members of my community, because these are centers that I grew up in. It's the Islamic Center is my mosque, and the Palestinian American Community Center is just a place that we all really go to really connect to our Palestinian identity. So when I was doing my research, I really chose to kind of stay close to home. But essentially, since, it's been successful, so I'd love to really get a wider sample and really reach out to more Arab Americans to help as many people that I possibly can. Thank you.
I actually have a question. So for you to conduct this research, which is really great, by the way, great presentation.
Thank you.
Was there something in your own household that provoked you to go through this?
Not necessarily in my own household, but I've seen people who are very close to me really have difficulties with trying to reach out and go to therapy, trying to really tell their parents, like, hey, I'm dealing with depression, or hey, I'm feeling really anxious today. Is it okay if I just take it easy? A lot of people in these minority communities, specifically in Arab American communities that I've seen at least, really don't acknowledge it or kind of brush it off as something that's not that serious, which is problematic. And I feel like as second generation, we kind of have that responsibility to start the conversation, to really make these older generation aware of things they may not have been aware of. It might not be just because they don't want their child to have an issue, but it might just be a lack of understanding and lack of mental health literacy, which is why I propose these programs to really educate more than kind of put down, oh, you don't believe in depression or anything like that. Because a lot of it is a lack of understanding, a lack of education, because they weren't exposed to it as much when they were back home.
Yeah, I completely agree with you. Thank you.
Sure.
So that takes us to about the end of our time. Thank you so much for your presentation and your thoughts. You really did a fantastic job, and I've learned a lot. Wrapping up this roundtable, we have Matthew Zember, who will discuss his family story, a documentary of the impact of Slovak immigration in Pennsylvania.
Good morning. I just want to say those were both incredible presentations, and it's going to be very difficult to follow up on them. So my presentation is about the Zemba family story. So let me share my screen. And can you all see the presentation? All right, so my name is Matthew Zemba, and so this is the Zemba family story, a documentary on the impact of Slovak immigration on Pennsylvania. So this was my honors capstone project for this semester, and so I am still in the middle of doing the documentary currently. I am in the final steps of doing the script writing as of now, and I'm hoping to have the documentary finished by the end of this month. So I want to let you know I'm still in the process of doing this project. Ever since I was a kid, I always wondered, where did the Zemba name come from? It was so unique. Still haven't really met anyone else with that same last name. And so I was inspired to research the genealogy of my family. And so for my capstone project, I did a creative research project about combining my family's genealogy and the research I have done prior with my communication journalism major in making a documentary. So before I get too far into it, I did want to explain a brief history of my family lineage. So the two people that I will be talking about the most throughout this documentary are my great-great-grandparents, John Zemba and Mary Wojciechowicz. So they are my great-great-grandparents, but an easier way to say that is they are my grandfather's grandparents. So John Zemba was born on November 8th, 1877, and my great-great-grandmother, Mary Wojciechowicz, was born on March 30th, 1894. And the picture in the first slide is the only picture I have of John Zemba because they did not have the money to take pictures. So we are very lucky to have a photo at all. So the documentary setup for the project basically involves 3 chapters. First, I talk about the life in Slovakia. Where did my family come from? What was life like in the early 1900s? Then I'll talk about the journey to America. What was it like and why did they leave their home country? And lastly, I'll talk about the impact on Pennsylvania. So not only talking about my family story, but also talking about the greater impact throughout all of Western Pennsylvania. So first up is the life in Slovakia. So I traced my family's lineage back to Lechnica, which is in Kežmarok, Slovakia. Slovakia is a landlocked country. It's in Central Europe. And so there are 4 countries that border it. There's Poland, Czechia, Austria, and Hungary. Throughout history, Slovakia went through several name changes, but at the time of my great-great-grandparents' birth, it was the Austro-Hungarian Empire. So Lechnica is settled in northern Slovakia. It is in the Carpathian Mountains, and it covers about 12.5 square kilometers, and currently has a population of 256 people, which is smaller than my high school. This means everyone knows each other, everyone is in each other's business, and it's quite a nice environment. So the main employment of these people was farming and shepherding. Because they are based in the mountains, often they raised sheep because the sheep provided food, it provided clothing, as well as an occupation for them throughout their lives. A strong impact or strong aspect of their life was their Catholic faith. So at the center of the town is St. Jodek Church. The Catholic faith was extremely important to the people of Slovakia. Oftentimes, the priest was the only person in the village who could read and write. So the priest had a lot of power. So around the end of the 1800s and early 1900s, Slovakia began to face several problems. They were beginning to face overpopulation and unemployment. I saw one statistic that stated that there was a plot of land that was meant for 12 families, and there were 32 families taking up that space. And so because of this, they began to set their eyes on a new country, and they began looking to America. So at the time, the Austro-Hungarian Empire was actively looking to send agents all throughout Slovakia to promote emigration to America, emigration meaning they wanted them to return. At the time of my great-great-grandparents' birth, Pittsburgh was experiencing their second industrial revolution, which meant there was a lot of factory jobs and a lot of unskilled labor that America was in desperate need for. So the Austro-Hungarian Empire struck up basically a compromise. They would send over Slovaks to America. They would pay for their voyage. The Slovaks would work in America, gain enough money, then they would return to Slovakia, bring their wealth with them. So there were two waves of Slovak immigration. The first wave took place in the late 1800s and very early 1900s. And the second wave, we will get into later. So the first wave is more so what I have described here. They were in the steerage of these ships, and the conditions were just not good. The journey would take roughly 2 to 3 weeks on boat, and they didn't have much space for personal belongings. Oftentimes, they could only take one suitcase with them. And I've seen stories where they would wear multiple layers of clothing just because they didn't have the space. They could only take very personal items with them, such as rosaries, because of their strong Catholic faith. These conditions were very dangerous, they were unhealthy, and honestly, they were pretty scary. They were all cramped in these lower parts of the ship, and there were no rooms to separate each of them. So as you can imagine, sickness ran pretty rampant throughout the ships, and it was quite the journey for them just to reach America. But then, once they reached America, they had to go through Ellis Island. And so I have a couple pictures of their process of going through Ellis Island. And, and they were subject to mental examinations and physical examinations. The biggest fear of the Slovaks was that they would be turned back and that they would be forced to return home. And oftentimes when you came to America, you had to show proof that you knew someone here in America, or else they could detain you and you have to wait until someone could come and pick you up. And so there were a large number of Slovaks that came to America between 1899 and 1918. There were over 480,000 Slovaks that came here. So the first wave was really the Austro-Hungarian Empire's push for immigration to come back to Slovakia. Then later on in the 1900s, from around 1907 to 1913, there was a second wave of Slovak immigration. My great-great-grandmother came over to America in 1914. So she was part of the second wave. And in the second wave, the Slovaks heard stories from their friends and their relatives here in America about how they were getting paid and what their conditions were like. So as more of these Slovaks heard these stories about America, they soon realized that they wanted to come over as well. The second wave of immigration mainly dealt with people who knew people here in America. That's why my great-great-grandmother came to America. Her brother, Andy Wojciechowicz, and her sister, Sophie Wojciechowicz, had previously immigrated to America in the early 1900s. So for the impact in Pennsylvania, I mainly examined 3 different categories. I looked at the economic impact, the political impact, and the cultural impact here in Western PA. So I have another statistic that between 1800 and the mid-1920s, there were between 450,000 and 500,000 Slovaks that were estimated to move permanently here to America. So when they came here to America, they were primarily in unskilled labor. They often took the jobs that other Americans here didn't want to take. Some main jobs were coal mining and factory jobs such as the steel mill. I received a photograph from the Vandergrift Historical Society, which is where my family ended up living. And I can see they are doing some very intensive labor. The conditions in these factories were not great. And if you were killed in these factories, there was no workers' compensation, which meant if a husband was killed in the factory, the wife had nothing, and she was really forced to remarry. My great-great-grandfather on my grandfather's other side, Louis Kubina, worked in the coal mines, and he was actually killed in the coal mines in 1928. So these jobs were extremely dangerous, and there were many, many workers who were injured or killed in these conditions. In 1910, 82% of Slovak males were either in the mining industry or in the iron or steel industry. Whoops, there we go. And then in terms of the cultural and political impact, so when the Slovaks came here to America, they often faced anti-foreign sentiment. Often they were called slurs such as hunkies, which is a twist on the word Hungarian. And oftentimes they couldn't read or write. And so Americans who were already living in the area saw them as unintelligent, and they faced discrimination. Because of this, a lot of Slovaks began to, which relates to Amani's presentation, they began to acculturate and assimilate into American society. Because of this, my family did not keep many of the customs from Slovakia, which is very upsetting because I'm so interested in all of this. And so throughout like all of their schooling, many of the Slovaks children were taught English because they wanted to be more quote unquote American and assimilate into society. However, this wasn't the end of their cultural heritage. Coming to America, the Slovaks began unions and memberships in clubs. So my great-great-grandparents came to settle in East Vandergrift, which is about an hour away from Pittsburgh in Westmoreland County. So in East Vandergrift, there is a Slovak club. And in these clubs, they would all gather together and embrace their heritage. Oftentimes, they would write letters to the home country, talking about what life is like here, what is going on. And then in return, the people from Slovakia would write a letter back. And oftentimes in these clubs, they would all gather together, drinking and have fun, and read these letters out loud to the whole community. Oftentimes these letters talk about the recent births and marriages and deaths in the community, as well as what was happening in and around their town. So to keep up their heritage, they also engaged in different community dynamics. A lot of their life, just like it was in Slovakia, was based around the Catholic Church. At the time of the early 1900s, and up until maybe 30 years ago, there were 3 different Catholic churches in East Vandergrift. And East Vandergrift is not a big town, so this is very significant. These different churches were related to the different ethnic groups that were in East Vandergrift. There was a Polish church, a Lithuanian church, and there was a Slovak church. So in the picture I have on the presentation, that is the Holy Trinity Slovak Roman Catholic Church. That is where my family went to church in the early 1900s. Sadly, this church no longer stands because it was demolished to, the Catholic Church was combining churches, and so it was torn down and is now the Our Lady Queen of Peace Church in Apollo. My grandfather remembers going into this church, and he stated that they lived on top of a hill, and they had to walk all the way down this hill and get to the church. And if that walk was already not difficult enough, you had to walk up several flights of stairs to get to the top floor. This is because East Vandergrift is built in a flood zone. So many of the buildings are built in a higher level to sustain floods, because there were several floods that happened throughout the history of East Vandergrift. So between 1880 and the mid 1920s, there were a lot of Slovaks that moved permanently here to America. I mean, it was a staggering number. And because they took these jobs, we can have a better life today. In 1907, that was the peak year of immigration in America. And so this is the only photo I have of my great-great-grandfather. Before doing any of this research, my family had no idea where we came from. We didn't even know where our home village was. So in this photograph, in the center of the photo are John Zemba and Mary Wojciechowicz, who are my great-great-grandparents. John Zemba sadly passed away in 1927. And because of this, Grandma Kubik was married 3 different times throughout her life. First to John Zemba, second to George Blazevich, and third to Frank Kubik. My family came to know her as Grandma Kubik because this was her 3rd marriage. She experienced the death of 3 of her sons, 3 of her siblings, and all 3 of her spouses throughout her life. And she had a really rough life. She went through a lot. And so I am very grateful that I can be here today because of their hard work. And that is about the end of my presentation. And yep. Stop sharing.
So it's really, really fascinating and very well done, and you told the story incredibly well. How did you actually do all this research? Like, what resources did you use?
Yes, so mainly I actually used Ancestry.com. I know they advertise a lot, but they were actually very helpful. I went through just hours upon hours. I've been doing this for about 3 years now, and it probably took me 2 years just to figure out the home village. Oftentimes, census records and church records are the most helpful. The Catholic Church was very good at keeping records. They were very detailed on the days they were born, the days they were married, and the days they died. And so because of that, it is easier to trace the lineage of the family. They kept details of the houses they were born in and the houses they died in. And they often listed the names of their parents, especially in their baptisms. So doing research in America is different than doing research in Slovakia. America was good at taking censuses every 10 years, whereas in Slovakia, because of all of the different name changes and the different powers that were ruling over them, there weren't as many records through the states. All of their records were through the church, which is kind of funny that the church had better records than the state did. Here in America, I really went through the census records, and even then it was difficult because the Slovaks didn't speak fluent English, and they weren't the most literate. Oftentimes their names were misspelled on the census. So you really have to go through slide by slide of these digital microfilms to really see who was living there at the time. And I really only knew the names of my great-great-grandparents. That was it. That's all I had to go off of. We knew nothing else. And so it took several years for me just to figure out that Lechnica is where we came from. And so I'm very grateful that I was able to figure all of this out. And it's nice that I can have this tribute to my family now, as well as doing this for school and for the Honors College. I can have this project for my family as well.
I didn't know microfilm was still something that existed. I thought everything was just on the internet.
Yeah, what they did is, so the Church of the Latter-day Saints, I'll try to shorten this because there's so much information, but basically they went around and were gathering records from all over Slovakia, and they were on microfilm, but now they are digitizing those microfilms. So you can go to the Church of the Latter-day Saints website and actually go through the microfilms, tab through them as if you're going through like a PowerPoint presentation, and they're all digital now, which is really, really helpful with genealogy research.
So we have roughly 10 minutes left in the session. So any more comments for Matthew? Any comments for any of the presenters? Now we've got time for just general discussion.
I do have a question for Amani. I'm just so curious because like I did all this research on Slovaks. I was curious with any of your statistics as you're researching Arab Americans. Did you come across statistics for other ethnicities like such as Slovak? I was just curious.
I did look because there is, like I said before, there is a lot of limited research for Arabs in psychology specifically, because of the overbearing stigma they have about mental illnesses. So I had to really go off of, for my literature review at least, I had to go off of research that has been done in different minority groups that I tried to get as similar, like maybe Turkish or things like that. So, but I haven't come across any Slovak research, but among the groups were Chinese immigrants, from Latino or Hispanic backgrounds. That's all that comes to mind now, but I haven't come across any Slavics. But if I do, I'll be sure to send you an email. And great presentation, by the way. I think that's very fascinating that you were able to do all of that. And just out of curiosity, what motivated you do it now? Like, did you have an interest always in your genealogy and just wanted to learn more and had the opportunity to do so?
Yes, that's a great question. And I guess it is a bit of a sad answer. Sadly, my father passed away in 2016. And so because of that, I wanted to really preserve the family heritage, just because, like we don't live forever. And so I wanted to do the research now before it's too late. Often like our grandparents, they know more than they think they do. And so it's really important to really preserve their heritage now, before they pass away, and you go, oh, I really wish I could have talked to them about it.
Yeah.
So that's really the main.
Amazing. That's great. I'm sorry for your loss, but that's a great way to honor your father and really keep the family kind of memory alive. And that's wonderful that you did this.
Yep. Yeah, I agree. I want to pass this on to my children, my great grandchildren, so that they can see the family story.
Kelsey had asked in the chat, how could we reduce the barriers that make it so difficult to immigrate legally? Does anyone have any thoughts on this?
I feel like there has to be obviously a lot of reform in higher powers of position. Like obviously the last presidency didn't really help with this. And although there were many steps forward with immigration policies, they also took many steps back. And this has been happening for a very long time now. And I feel as though that there has to be a much greater representation of minorities in Congress or like any high state of power in order for this to happen. Like people who actually know the struggles of an immigrant because they experience it firsthand or they know of it firsthand, instead of someone who is of a completely different race and of a completely different culture who hasn't had anything to do with these kind of things.
So thank you.
I just wanted to make a comment on Matthews. I really love how you wanted to make this a kind of like a contribution to your family line. And again, my condolences for your father's passing, but it's great that you're taking so much time out of your life to really dedicate to find out more about your family, because a lot of us immigrants don't know anything about our family origins. It's much more difficult for us to really look back into history and be like pinpointing everything. So like what really let me see, what was like the most difficult thing about this other than research, obviously, because there isn't much as you claimed?
Yeah, definitely. I think one of the hardest things for my research was that my grandfather didn't really know anything about his granddad, so John Zemba, my great great grandfather. And so since we didn't have many stories and not much to go off of, it felt like I was really starting from scratch. And so it really took a long time for me to really put the pieces together. I mean, names being misspelled, dates being incorrect. There's not all the records here in America were as correct as the church records in Slovakia. And so having to trace back that line with having that language barrier, it was very difficult to really find the different names. I mean, I saw Zemba spelled CZMBA, which is completely incorrect, just because the census takers, they weren't able to understand what they were saying. So that was definitely one of the greatest challenges, is not having much to go off of.
Yeah, but it's great that you're really dedicated to this. So thank you for sharing.
Yes, thank you.
So we have 5 minutes. Any last questions or comments? I also do want to just get a screenshot of everyone. So a couple of you guys don't have your cameras on. If you don't mind, you could turn your cameras on for a second just for the screenshot as we get one last couple last questions or comments. Everyone could wave hi and smile. That's great, thank you. Any last questions or comments? And if anyone wants a screenshot, I can post it in the chat in a second. I just have to move it over to Paint and save it.
Really great presentations, everybody. I don't have a specific question at the moment, but I feel like I have a question. Like, I'm curious to know more about things, but I can't think of a specific question. So if anybody has anything else random you want to share.
Thank you, Kelsey. Oh, Matthew, you can go ahead. Go ahead.
Oh, I was just gonna really make a statement. I just wanted to say, you know, like just thank you to everyone, and like I just thank you to Amani and Magali. I mean, it's just I'm so happy that we're bringing these important issues to the table. I think it's great that we can really have a conversation about this. And so I just want to say just thank you for your research and for your presentations.
Yeah, I completely agree. I was really grateful for this opportunity in the first place, and the fact that I was in a group with like these amazing presentations as well. So like, thank you for having the time to share this. I feel like this is something that we have to talk about more, because although you do hear stories about immigrants, it's like you don't know the actual experiences about them. So like obviously the hardships that they face here in the United States, what they face in their home countries, and like the whole immigration process in general is something that we don't talk about, but it deserves to be noticed.
Definitely. And thank you both for your presentations. They're very insightful and I learned so much. And I feel like us as kind of second generation Americans who come from different backgrounds really have that motivation and that drive to make things better for ourselves and for the future generations. So I think we're doing a great job. And as I keep saying, starting the conversation is really where we should start and what is kind of the beginning of it all. So great job. You guys should be very proud of yourselves. And thank you for everyone for attending this conference. And though it is virtual, I think it worked out pretty nicely.
I think we're going to save that quote and use that as our tagline. Even though it was virtual, I think it worked out just okay.
Yes.
Any final thoughts? Well, I want to thank everyone for presenting. I really learned a lot. As I said at the beginning, this is really outside my wheelhouse. I'm a scientist by training, so this is not what I do. So I really learned a tremendous amount. It's fantastic to see the scholarship that you guys are displaying, and it really warms my heart of the fantastic work that students in our region are doing. With that being said, we do have our closing and our award ceremony coming up in just over 15 minutes. So hopefully you will attend the closing remarks and see the award ceremony. Hopefully I'll see you there. Otherwise, I wish everyone an enjoyable rest of the day. Have a very successful end to your semesters and be well.
Thank you, everyone. Take care.
Thank you. Have a good day.
Thank you.
Thank you.